Welcome back to Daytime, everyone. Simple screenings are the key to preventing diseases like colorectal cancer, the third most commonly diagnosed cancer and the second leading cause of cancer deaths among Americans. A colorectal screening can not only detect the presence of cancer, it can even prevent it from forming. Here to tell us more is Dr. Sudhir Kalaskar with AdventHealth. Hi, doctor.
Hi, thank you for having me here.
Oh, our pleasure. So who should be screened for colon cancer and when?
So the current recommendations are you should start your colon cancer screening at the age 50. However, in the recent past, we have seen a trend that younger patients are getting cancer, especially the colon cancers. So the American Cancer Society has come up with another recommendation which says you have to start your screening at age 45 instead of 50 years. And to the question of who should do the screening, people who have strong family history of colorectal cancer, other than starting your screening at the age 50, should be screened.
What are some of the risk factors apart from having it in your family?
Other risk factors are obesity, diabetes, high consumption of processed meat, consumption of alcohol, smoking, and low levels of physical activity. So those are the main things that kind of contribute towards, increasing risk of colon cancers.
And what should we be looking for to identify the signs of colon cancer?
So the most important thing is if you have any unexplained bleeding from the rectum. So you're seeing any bleeding that was never there before, and that's number one. Other than that, if you have any change in your bowel habits, especially change in the caliber of your stool, if there is any unexplained weight loss, or if you have unexplained anemia, or if you have abdominal pain that's not been explained and you fall into that age group, so I would recommend go speak to your primary care doctor and tell them the symptoms, and probably it's a time to get screened at that time.
So why are colorectal cancer screenings so important, and how can people overcome colonoscopy anxiety?
So colorectal cancers, as you mentioned in the beginning of this of the talk, you said are the third most common leading cause of cancer deaths in the United States, both in men and women. Also, the cancer is rising in younger population. So keeping that in mind, it's important that everyone gets screened. So once we get screened and you're good to go, at least if you don't have any cancers for 10 years. So which is kind of, in your lifetime, you're probably going to get 3 or 4 colonoscopies. So it's life-saving. That's what I would say. And to the other point of, anxiety or colonoscopy anxiety, that's a real thing. I mean, I get it every day in my office. Patient comes in and, oh, my uncle had a colonoscopy, my aunt had a colonoscopy, and they had really bad time. So what I would say is things have changed, and we have different kinds of preps now. And we can always talk about it. And there's different ways we can make you comfortable. And that's why it's always better to talk to your physician or your specialist. So that's the take-home point.
I can attest to that. Had it done, wasn't bad. Dr. Kalaskar, thank you very much for joining us today. Thank you. And for more information, you can visit yourcareyournetwork.com. Daytime will be right back.